When it comes to understanding how ginger affects blood pressure, we're diving into a topic that has intrigued both traditional medicine practitioners and modern scientists for years. Ginger, or Zingiber officinal, is one of those herbs that has been used for centuries in various cultures, not just as a culinary spice but also as a medicinal remedy. And when we talk about its potential impact on blood pressure, we're touching on something that can have profound implications for cardiovascular health. Let's start by talking about blood pressure itself, because understanding what it is will help us better grasp how ginger might influence it. Blood pressure refers to the force exerted by circulating blood against the walls of your arteries. It's measured in two numbers: systolic pressure, the top number, and diastolic pressure, the bottom number. Systolic pressure represents the force when your heart beats and pumps blood, while diastolic pressure reflects the pressure when your heart rests between beats. When these numbers are consistently too high, it's called hypertension, which is a major risk factor for heart disease, stroke, and other serious health issues. Now, ginger has long been celebrated for its anti-inflammatory, antioxidant, and digestive properties. You've probably heard about ginger tea being a go-to remedy for nausea, motion sickness, or even cold symptoms. But when it comes to blood pressure, the conversation becomes a bit more nuanced. Some people claim that ginger can help lower blood pressure, while others are curious if it might inadvertently raise it. To get to the bottom of this, we need to look at the active compounds in ginger and how they interact with the body. Ginger contains bioactive compounds like gingerol, sugall, and zingerone, which are responsible for many of its health benefits. These compounds have been studied for their ability to reduce inflammation, improve circulation, and even support heart health. One of the ways ginger might influence blood pressure is through its vasodilatory effects, meaning it may help relax and widen blood vessels, allowing blood to flow more freely. This could theoretically lead to a reduction in blood pressure, but here's where things get interesting. Ginger doesn't just affect blood vessels. It also interacts with the nervous system and certain hormones that play a role in regulating blood pressure. For example, some studies suggest that ginger may inhibit the activity of angiotensin-converting enzyme ACE, which is involved in constricting blood vessels. By blocking this enzyme, ginger could potentially help keep blood vessels relaxed and reduce blood pressure. This mechanism is similar to how certain prescription medications, like ACE inhibitors, work to manage hypertension. However, it's important to note that the research on ginger and blood pressure isn't entirely conclusive. While some studies have shown promising results, others have found no significant effect. For instance, a 2015 review of clinical trials looked at the impact of ginger on blood pressure and concluded that ginger supplementation might have a modest lowering effect on blood pressure, particularly in people with hypertension. However, the authors also pointed out that more large-scale, well-designed studies are needed to confirm these findings. Another angle to consider is that ginger might have different effects depending on the dose and form in which it's consumed. Fresh ginger, dried ginger, ginger powder, ginger tea, and ginger supplements can all vary in potency and bioavailability. For example, drinking a cup of ginger tea might not have the same impact as taking a concentrated ginger capsule. Additionally, the amount of ginger you consume matters. A small amount of ginger added to your meals is unlikely to cause any dramatic changes in blood pressure, but higher doses, especially in supplement form, could potentially have a more noticeable effect. Now, let's talk about the flip side of the coin. Could ginger ever raise blood pressure? While there's limited evidence to suggest that ginger directly increases blood pressure, there are a few scenarios where it might indirectly contribute to elevated levels. For instance, ginger is known to stimulate circulation and increase heart rate in some individuals. If someone already has an underlying condition that causes their blood pressure to fluctuate, this stimulatory effect might exacerbate the issue. However, this is more of a theoretical concern than a widely observed phenomenon. It's also worth mentioning that ginger can interact with certain medications, including those used to treat high blood pressure. For example, if you're taking anticoagulants or blood pressure-lowering drugs, combining them with ginger might amplify their effects, potentially leading to complications like low blood pressure or increased bleeding risk. This is why it's always a good idea to consult with a healthcare provider before adding ginger supplements to your routine, especially if you're managing a chronic condition or taking prescription medications. On the positive side, ginger's Potential benefits for cardiovascular health extend beyond just blood pressure. Its antioxidant properties help combat oxidative stress, which is a key contributor to heart disease. Oxidative stress occurs when there's an imbalance between free radicals and antioxidants in the body, leading to cellular damage. By neutralizing free radicals, ginger may help protect the heart and blood vessels from damage over time. Additionally, ginger's anti-inflammatory effects can help reduce chronic inflammation, another major risk factor for cardiovascular problems. Speaking of inflammation, let's delve a little deeper into how ginger's anti-inflammatory properties might tie into blood pressure regulation. Chronic inflammation is closely linked to the development of hypertension because it can damage blood vessels and make them less elastic. When blood vessels lose their flexibility, the heart has to work harder to pump blood, which can drive up blood pressure. By reducing inflammation, ginger may help preserve vascular health and prevent the progression of hypertension. Another fascinating aspect of ginger's potential impact on blood pressure is its role in improving lipid profiles. High cholesterol and triglyceride levels are often associated with an increased risk of hypertension and heart disease. Some studies have suggested that ginger may help lower LDL bad cholesterol and triglycerides while boosting HDL good cholesterol. By promoting healthier lipid levels, ginger could indirectly contribute to better blood pressure control. Now, let's shift gears and talk about practical ways to incorporate ginger into your diet if you're interested in exploring its potential benefits for blood pressure. One of the simplest ways is to use fresh ginger in cooking. Grating a small piece of ginger into soups, stir-fries, or smoothies can add flavor without overwhelming the dish. You can also make ginger tea by steeping slices of fresh ginger in hot water, optionally adding lemon or honey for extra taste. If you prefer convenience, powdered ginger or ginger capsules are available as supplements, though it's essential to choose high-quality products and stick to recommended dosages. Of course, moderation is key. While ginger is generally considered safe for most people, consuming excessive amounts can lead to side effects like heartburn, diarrhea, or mouth irritation. Pregnant women, individuals with gallstones, or those with bleeding disorders should exercise caution and seek medical advice before using ginger therapeutically. It's also worth noting that ginger alone isn't a magic bullet for managing blood pressure. A comprehensive approach that includes a balanced diet, regular physical activity, stress management, and appropriate medical care is crucial for maintaining healthy blood pressure levels. To wrap things up, the relationship between ginger and blood pressure is complex and multifaceted. While there's evidence to suggest that ginger may help lower blood pressure through mechanisms like vasodilation, ACE inhibition, and anti-inflammatory effects, the extent of its impact can vary depending on factors like dosage, individual health conditions, and concurrent medications. On the other hand, there's little to no evidence that ginger raises blood pressure under normal circumstances, though its stimulatory effects on circulation warrant some consideration. Ultimately, ginger can be a valuable addition to a heart-healthy lifestyle, but it shouldn't replace conventional treatments for hypertension. If you're curious about incorporating ginger into your routine, start small and pay attention to how your body responds. And as always, don't hesitate to reach out to a healthcare professional for personalized guidance. After all, when it comes to managing blood pressure, knowledge and proactive care are your best allies. So, whether you're sipping on a warm cup of ginger tea or sprinkling some grated ginger onto your favorite dish, know that you're not just adding flavor, you might also be supporting your cardiovascular health in subtle yet meaningful ways. And who knows, with more research on the horizon, we may uncover even more reasons to embrace this versatile route.